Hello, my name is Blaizot and I'm the first author on the research team of the Department of Dermatology in the University Hospital of Bordeaux in France that has recently studied the infectious events and associated risk factors in patients with mycosisfungoides and Sézary syndrome. We did this study because we know that many patients with mycosisfungoides or Sézary syndrome die of infections, but we actually have very few informations on what kind of infections actually happen in these patients, and we don't know if there are risk factors associated with the occurrence of infections. We included all patients diagnosed with mycosisfungoides or Sézary syndrome in our department over a 5-year period, and we retrospectively screened their medical files looking for infectious events, and we recorded biological and clinical risk factors at the time of infection that could be associated with a higher risk of infectious event. The two most frequent type of infections were skin infections and bacterial pneumonia. Now, skin infections were quite expected, as we know that these patients have many skin lesions that can be complicated with secondary infections. Lung infections were less expected, but then again, when you think about it, we know that patients with mycosisfungoides or Sézary syndrome have less functional CD4, which is similar to what can be observed in patients with AIDS. And we know that patients with AIDS have more bacterial pneumonia than other people. Our second finding was that opportunistic infections caused by germs which are typical of people with an impaired cell-mediated immunity, germs like toxoplasmosis or pneumocystis, were very rare. However, our patients with low CD4 count were usually under prophylaxis with cotrimoxazole, which may have prevented such infections. And our third finding was that lymphocytopenia, Sézary syndrome, and chronic organ failure were statistically associated with a higher risk of infectious event. So this study should lead dermatologists to propose pneumococcal vaccine to their patients with mycosisfungoides or Sézary syndrome. It also confirms the utility of prophylaxis with cotrimoxazole in patients with low CD4 count. And a specific follow-up should be advised for patients with chronic organ failure, lymphocytopenia or Sézary syndrome.